Welcome back to my channel, fellow learners. This is Ray Gapuz, your mentor Ray. And today, we're going to talk about, once again, a topic that you need to master before you attempt to sit for your test. But before we start, I'd like to ask you to join me in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. To help us achieve this, just watch and finish the ads in our videos. Thank you. So if you want me to tackle any topic that you may want me to expound, simplify, or focus you on, please don't hesitate to send in your questions or requests through this email, mentor.raygapos@gmail.com. And here's the disclaimer. Today, we're going to focus on physiologic versus pathologic jaundice and the use of phototherapy. So let's begin. Phototherapy lowers the bilirubin levels in the blood through the photooxidation process, which facilitates the conversion of your indirect bilirubin to direct bilirubin, which becomes more absorbable in the body. Okay? So hyperbilirubinemia or neonatal jaundice, as we commonly referred to, refers to a condition characterized by elevated serum bilirubin levels related to destruction of red blood cells and reabsorption of unconjugated bilirubin from the small intestine. So what does this mean? When you are having jaundice, it simply means that your red blood cells are being destroyed. And whenever a baby is born with jaundice, it simply means that they are having RBC destruction while they are still inside their mother's womb or while in utero. So this is where we need to differentiate the two common types of jaundice. You have your pathologic jaundice and physiologic jaundice. Now, jaundice that occurs or jaundice that is present within 24 hours after birth is known as pathologic jaundice. So it could simply mean that the child or the baby is having RBC destruction while still in utero. So this could be associated with RH incompatibility or ABO incompatibility. Okay, so bilirubin increases to more than 5 milligrams per deciliter per day when a client has pathologic jaundice. Okay, physiologic jaundice, on the other hand, appears on the second or the third day, and it peaks between the 5th to the 7th day. Now, it resolves by 14 days for full-term babies and by 21 days for preterm babies. Now, take note, what are the two differences of pathologic and physiologic jaundice? Your pathologic jaundice occurs earlier, within 24 hours after birth. That's one. For your physiologic jaundice, it occurs or appears on the second or the third day. Okay. Another difference is, okay, your pathologic jaundice indicates RBC destruction that could be associated with medical conditions. In physiologic jaundice, this may indicate RBC destruction of excess RBCs. So in essence, your physiologic jaundice could be expected as it will not do harm to the baby for as long as it is properly managed. So your priority nursing diagnosis for a child with pathologic jaundice would be risk for injury because they could be at risk for CNS involvement like kernicterus, jaundice to the brain, or the child would usually have encephalopathy. Okay, so the child may have encephalopathy. Now, for physiologic jaundice, your priority nursing diagnosis could be deficient knowledge because the mother could be so alarmed or so anxious that the child is yellowish. But if you explain to her that this is a physiologic alteration that is expected on the second day up to 14th day for a full-term baby and 21 days for a preterm baby, then it will definitely allay the patient's anxiety. Okay, so your priority whenever you see that a baby is jaundice and you never have any idea, you never had any idea when the onset of the jaundice occurred. So your priority should be to check the age of the baby. If the baby is less than 24 hours and the baby is jaundice, then we term that pathologic jaundice. If the baby is already on the third day and the baby has jaundice, then we could classify that as physiologic jaundice. Okay. Now let's try answering a sample question related to the use of phototherapy. Here we go. Which interventions are appropriate when implementing phototherapy? Position the unit no more than 30.5 centimeter from the client. Yes, it could actually be positioned between 15 to 30.5 centimeter. So we put a check. Use opaque eye covering to cover the eyes. Yes, that is usually done to protect the baby's eyes. We put a check. Monitor the vital signs every 4 hours. When we monitor the vital signs, we focus on the temperature of the child. So yes, that's a check. Continue breastfeeding, but limited to 20 minutes. Yes, we could actually take out the baby for a short period of time to breastfeed the baby. Usually this is done every 3 to 4 hours. So, but we have to make sure that when we take the baby out of the phototherapy, it has to be for a limited period of time, around, some literature say 20 minutes, some would say 30 minutes. So 20, 30 minutes would be all right. So we put a check on that. Strictly monitor fluid balance. Yes, as this treatment could potentially cause insensible water losses and fluid losses on the baby. So it's very important that we check fluid balance by monitoring the baby's urine output as well as the intake. So we put a check. Breastfeeding is continued for infants nearing exchange transfusion. Now, for infants who are now being prepared for exchange transfusion, it's very important that they remain in the phototherapy treatment, okay, continuously. So this is an X. We do not bring the baby out for breastfeeding anymore. Okay, and then expose as much skin surface of the infant as possible. Yes, and it's also very important that the bilirubin levels of a child undergoing phototherapy should be checked every 4 to 6 hours. Now, we have to remember that phototherapy is usually implemented if the bilirubin level of the baby is already twice, okay, the 5 milligrams per deciliter that is set, okay, as the benchmark for the maximum amount of bilirubin for a newborn baby in the first 24 hours. So it simply means that when the bilirubin level of the baby reaches 10, that's when phototherapy treatment is usually implemented. Okay, so once again, I'm your mentor Ray, saying a functional concept a day keeps your NCLEX RN fears away. So if you love this video, please don't forget to subscribe and hit the like and bell buttons. If you do and you share our videos to at least 3 of your friends, those who are taking the NCLEX will shut down at a minimum item of 60 and pass, and those who are preparing for the HAA, the DHA, and the Prometric test will all pass the test if you share our videos to at least 3 of your friends. Here, once again, I'm your mentor Ray, saying thank you for joining our learning session today. So let's learn together. If you have any requests that you may want to be cleared on, please do send in your request to my email, mentor.raygapuz@gmail.com. Thank you and see you in our future videos.